Dr. Wilson is currently president of the New York Association of Naturopathic Physicians, specializes in women's and children's health at her practices in Greenwich, Connecticut, and New York City. Her passion is to address stress-related conditions by balancing hormones and neurotransmitters. Dr. Wilson.
Actually, do you need a microphone? Don't interrupt the talk. Excuse me. Okay, thank you so much. I'm so excited to get to present this information to all of you. And I'm really going to speak as if I'm speaking to my patients, because that's how I see it. So healing women, the way I think about it is inner messengers and inner messages. And I'm going to go into more detail about that. I'm going to go into more detail about empowering through understanding, and how by helping patients to understand their bodies, they will be empowered to heal themselves. And then I'm going to talk about supporting the healing within, and how I do that in my practice as a naturopathic doctor specializing in women's health. So the inner messengers, these for me are the hormones and neurotransmitters that are sending messages throughout the body, and all of the body is then responding. And it's I find in my practice that it's a really useful way to help patients understand themselves and why they're coming in complaining of fatigue. So often people come in, they're tired, they can't sleep, their mood is not good, and they may have digestive issues and skin issues, and they don't realize that there's a way that they're connected. And so describe it, and I'd love to hear as well how you describe it. What I say is that so you start with day one, and first thing is just explaining that the period is day one of the menstrual cycle. Let's start with that, and I draw that. I have a day one, and then I put day 14 to 16 is when ovulation most often happens in a regular menstrual cycle, and then you get to day 28, which is when that's the end of the cycle, when the next period happens. And different from my perspective, in that I say from day 1 to 14-ish, you're mostly talking about estrogen. And from day 14 to 28, you have both estrogen and progesterone. And the light bulb that really helped clarify for me, for all different women's health conditions, is to understand that when women ovulate, they make progesterone. That's where the progesterone, I don't know how obvious that may be to you, but when I say that to a patient, progesterone happens when you ovulate. And so that's why from day 14 to 28, there's progesterone and estrogen around. Now, if ovulation happens in less than it could, or it doesn't happen at all, there's less progesterone, or much less progesterone going on in the body. And that's often what's going on in women's health-related conditions, whether you're talking about PMS, whether you're talking about perimenopause, whether you're talking about fertility. Very often it has to do with low progesterone levels. You guys with me? How health conditions really start with stress. So stress comes in, and when the brain responds to stress, it sends the signal to the adrenal glands, stress, and makes cortisol, and the cortisol should feed back and turn off that cycle. But when people are under a lot of stress or constant stress, that feedback turn off doesn't happen, and the cortisol keeps going. Now, cortisol affects mood. It definitely has been shown high cortisol and low cortisol are related to depression. Cortisol lowers the immune system, or it changes immune system balance. So someone could be more likely to have allergies, autoimmunity, cancer. So when I'm describing this to patients, they start to go, oh, and I can say, if to a person who has allergies, now I can say, this is probably, the stress happens, the adrenal gland response happens, your immune system gets affected, and that's why you're more predisposed to allergies now than you were 5 years ago or 20 years ago. On the whole supermom concept that's been around for a while, I see something a little different than that. I see that, women are choosing careers and choosing family and needing to find a new way to do all of that in balance. And however, you can do progesterone by itself. Progesterone doesn't have to have estrogen with it. And adapt and respond over several months? Or do you want to see change this month? You know, are you wanting to get pregnant this month? Are you okay to wait 6 months? And that sometimes determines where I start with the dose. You want it during that time between ovulation and the next period. So you're talking to your patient, when was your last period? Let's get the calendar out and count.
I have no idea.
You have a lovely zipper break.
Okay.